Welcome to the Mental Health Merienda, your snack science guide to mental health wellness. I'm Dr. Adeline Leon, licensed clinical psychologist specializing in neuropsychology.
And I'm Michelle Young, licensed clinical social worker. So, on today's show, we'll be discussing burnout, science to help you identify it, and tips on how to improve your coping. So, burnout is a state of emotional and physical exhaustion caused by excessive and prolonged stress. And although we can see it in several areas of life, so parenting, caretaking, even in our romantic relationships, today we're going to focus on burnout associated with work.
And not everyone feels burnout, but there are some common causes and risk factors. So, according to the Mayo Clinic, here are 6 of them. First one is lack of control. And so that definitely can cause burnout. So, not having a say in how you do your job, like your schedule, assignments, workloads, that can lead to job burnout. Not having what you need in order to do your job, which you can imagine can be incredibly stressful, and that can lead to significant burnout.
Yeah, definitely. I mean, if you don't know like what you need to do, or you're not having what you need to do to do your job effectively, and if you're being told that you're not doing it well, it's like a double edged, like you're hearing like negative from both sides. That's very stressful. Yeah.
Yeah. Lack of clarity, which is very related to not having what you need to do, not really knowing how to do your job. So, not being clear about what's expected of you can lead to burnout. I know I've definitely felt that way where I've been in a new job and I'm not really sure, am I doing this right? Am I not? Am I really following what I'm supposed to do? And that's so stressful, and that uncertainty, that stress, because really that's what we're getting at with burnout is that it's an additive stress. It's cumulative stress where one thing over another. And so it's never just one thing, but really having that lack of clarity and not being sure about what your bosses want from you. Not that can really make you feel like you're not doing a good job because you don't really know what's considered a good job.
Yeah. And I think a lot of people can relate to this. There might be, some situations where a boss or management is unclear or maybe not great at communicating expectations. So I can imagine this is, something that I'm sure I felt this way, like if I think back to earlier, earlier working experiences.
Mm-hmm. And then conflicts with others, which I think that definitely makes sense. If you feel like your coworkers are against you, if your boss is too involved in your work, so if you feel like you're micromanaged, yeah, which I can definitely relate to that in my past jobs where I felt like everything I was doing was watched very closely, and then I think anyone would feel really self-conscious about what they're doing. Like every single little move you make is being watched, and so you don't want to. When it comes to burnout, it's all about moderation. So you don't want a situation where your boss is so detached that you don't really know what you're doing. You're not getting feedback because that can make you feel like you're ineffective. But at the same time, if you have a boss that's so involved, and again, kind of micromanaging, then you can feel like you're under a microscope, and that's not great either. And either one can really lead to burnout. And so that can really add to your job stress.
And I want to go back to what you were saying about coworkers. I think, having great coworkers, making friends on the job is such a nice perk because you get to meet people that maybe you would have normally not met, like in college or in high school, if people are different ages. And if you don't like your coworkers or you feel like all your coworkers have like little cliques and you're not a part of it, it's almost like being in high school again, where there's like these like little groups and there might be like people talking behind your back or gossiping. Like, oh, that's a terrible feeling too. You can't be effective
Yeah.
at work. That's your environment.
Yeah, it really is.
So another thing is too much or having too little to do. That's something that can lead to burnout. So with having too little to do, maybe your job is really boring. You're not feeling like you're making a difference. And then for having too much to do, if you're so busy that you can't keep up with the demands, if you have a heavy workload and you work like really long hours, you need a lot of energy to stay focused. And then having to like maintain that for so many hours, that leads to fatigue and to job burnout. And I could definitely to relate to both. I've had jobs where, I didn't enjoy it. I was bored, or maybe like I finished everything like really quickly. And I was just like, I don't want to just sit here. I think a lot of people can relate to that. You don't want to just like sit around and do nothing.
Yeah, and I think it's funny because if you're someone who feels very overworked, I think the grass is always greener on the other side, and so you might be thinking, well, I would love to have a job where I'm bored. You hear people say, "Oh, I would love to have your job where I don't have enough to do." But the thing about work is that you want to feel, and this is a big thing that's involved in burnout, is feeling like your job is not aligned with your values, like feeling like you're not doing something that's important to you. Because when we think about motivation at work, money is an extrinsic motivator. That is a motivator. But what's a bigger motivator is intrinsic motivation. So coming from inside. So feeling like you're making a difference, feeling like you're doing something important that really matters, that's what really motivates you. And so if you feel bored, like you're not given enough to do, you can really lack that intrinsic motivation to feel like, why am I even here?
Right. Yeah. I'm not doing anything like, oh, like this. And you have like an existential, like almost like, why am I doing this job? I'm not making a difference. And then on the flip side, there's that being too busy. Even if you are doing something that you love, that gives you a lot of intrinsic motivation. If you're working long hours, that's all you're doing. I mean, that's really exhausting. Just like even like thinking about it is really exhausting and can lead to fatigue and burnout. And yeah, we'll kind of get into that a little bit more. So another thing that can lead to burnout is lack of support. So if you feel like you're alone at work or even maybe in your personal life, you might feel more stressed. So I think that kind of relates to having that, maybe conflict with coworkers. If you feel like you don't have any social supports, friendships, colleagues, people that you like and kind of can talk to at work, that could lead to burnout because you're almost like suffering in silence. And then the last one is problems with work-life balance. So for a lot of us, like you and me, Adeline, working in the helping profession, I think nurses, doctors, people working in healthcare, those jobs involve a lot of giving yourself to other people. And those jobs are at really high risk of having, work-life balance issues. So maybe your work takes up so much of your time and energy that by the time you come home, you have nothing left to give to your partner. You have nothing left to give to your kids if you have kids. So that's also something that's really dangerous and can lead to burnout.
And I think especially with working in mental health, it's so difficult because you have to have a level of empathy for the people you're caring for. But at the same time, if it's so much empathy that where it's really affecting your life, where you're coming home and you're, thinking about your client and, oh, what happened to them? Oh, are they okay? And it's happening to you with several clients. If there's always those one or two where you do think about them when you get home and you do hope that they're okay if they've been in crisis or anything like that. But if this is happening to you over and over again with several people, then really it's impacting your personal life. And so that's where you start to have that difficulty with work-life balance. And where do you draw the line between where does work stop and where does your personal life start?
Yeah, definitely.
Mm-hmm. And so the thing about burnout is that it's insidious. So that means it creeps up on you. So it can be really hard to identify because many times it could be concealed by other factors. So you might think like, oh, I'm just getting older, or, oh, my coworkers changed. I'm not as fond of these coworkers, or my boss changed. That's actually a really big one. Or maybe it's just a phase. Maybe it's just, I'm just in a funk. But burnout can be confused with stress, but there are some key differences that are really important to point out. Stress is short-lived and it's tied to a specific goal. So, for example, if you are really stressed out about a test that you're studying for, once you take the test and you do well, then that stress will subside. When it comes to burnout, that stress feels never ending and it comes with feelings of emptiness, apathy, hopelessness. And so that feeling of, oh, it's just not going to get better. And, oh, I just don't care anymore. You almost feel a little numb because you're just so overwhelmed by stressors. And that's definitely a big, some key differences there to point out if you're questioning whether what you're experiencing is stress or burnout.
Yeah, I think when you were mentioning emptiness, apathy, hopelessness, immediately I thought like, oh, like you're numb at work or you're numb thinking about your job. Yeah, that's a good indicator of that. So according to a psychologist, Dr. Christina Mashlock, she's a pioneering burnout researcher. So there are three main signs of burnout. The first one is decreased professional accomplishment. So related to work, burnout can be expressed in a lot of ways. From fear of making mistakes, thinking that you're not able to keep up with your colleagues, poor self-esteem, and loss of meaning in your career. So you may feel ineffective, you lack accomplishment at your work.
And then number two is overwhelming exhaustion. So, overwhelming exhaustion caused by work burnout can present itself in a few different ways. You might find that you have to drag yourself out of bed in the morning to get to work. You have trouble starting on job tasks. It's harder to focus. You're getting distracted more easily. So maybe you're going to your phone more. You're opening up different apps, social media apps, a lot more than you typically would. And it doesn't just refer to a physical exhaustion; it's an emotional exhaustion. So I think about the kind of sort of popular thing on social media, like Sunday scaries,
I
and
was
so
thinking
that's
that
the
too. I was like,
Mhm.
oh, wow, it's like Sunday
You read my
scary.
mind. Yeah. So yeah, with the Sunday scaries, it's for anyone who doesn't know, it's that feeling that some people might have on Sunday afternoon, Sunday evening, when there's the upcoming work week is going to start on Monday morning, and that it could be a little feeling of like stress and doom, almost like you're just dreading it, you never want to feel like that about your job, and so that can definitely be an indicator of burnout. It could be an indicator that you're not in the right job, but it could also be an indicator of burnout.
The third one, cynicism and detachment. So those are key signs of work burnout. So there was another study that was done in 2007 by a researcher in palliative care, Dr. Balfour Mont, and they found that participants suffering from burnout described an existential vacuum. So it's like a crisis of meaning, this inability to find peace. You might feel disconnected from your coworkers, like you're on autopilot. So you're just kind of going through the motions. And cynicism can be especially worrisome for those of us in the helping profession, as we mentioned earlier, like doctors, nurses, and for us in mental health, because we do have to have empathy. That's a big part of our job, is having empathy for our clients. And when you're on autopilot, you're not able to have that empathy as much for the people you're supposed to be caring for.
Yeah, I'll say full disclosure, I have completely felt this burnout at work, and specifically this cynicism and detachment. I think back to my training days when I was doing my clinical internship, and clinical internship is a year where it's the last year of your PhD training. It's a really intense year. At least in my case, I was working about 60 hours a week and working on my dissertation, waking up at about 4 o'clock in the morning to work on my dissertation before I went into work, working till 9 p.m. And then I was working at an inpatient hospital in a rehabilitation unit. And so working with very acute patients at times. And so that cynicism, I started to notice that in myself. And I actually decided to look up some reading material that would kind of help me with kind of fighting through that. At the end of the day, I think really what helped with that burnout was the fact that I knew that it would be a 1 year period, and that it is supposed to be a very intense, very stressful year. And so that talking to people about it really helped too. But most definitely, I can very much relate to that. And that cynicism, when you're in the helping field, can really impact your work and your effectiveness and ability to really help people you're caring for.
Yeah, I think that whole existential vacuum, I like that
Mhm.
phrase
Yeah, me
because,
too.
yeah, and I, like you, not at the same exact experience, but I have felt like at certain positions where I'm just like, I'm on autopilot. I don't think that, like, I don't feel good. I feel numb, as we mentioned earlier. And then it's really important, and we'll talk about, how to cope, but it's really important to recognize those feelings, because oftentimes we don't even realize until like maybe down like a little, when it's like little, like, oh wow, a lot of time has passed that I've been feeling this way.
So, if you're recognizing you might be experiencing burnout, we have some tips for you to help you. There are 3 tips that can help you cope, and these are according to the American Psychological Association and also the Mayo Clinic. So, number one tip is to look at your options at work. And so, I think we'll see a lot on social media or hear from people, if you're stressed out or burnt out at work, like, oh, just vacay mode or out of office
I'm
or
planning my next trip.
Mhm,
Yeah.
right. And and we love vacations. Vacations are great, but that's not really addressing the root cause of the issue, which is your job. And so when you look at your work, one thing you could do is to establish boundaries. Could be in a few things. It could mean making a rule for yourself not to check work email from home in the evening, not answering your phone during dinner. I would hope that you're not getting too many work calls when you're at home, but I know that all depends on what you do for a living as well, especially if you are on call sometimes. Creating some clear boundaries between these areas that can really reduce the potential for that work life conflict and that stress that can come along with that.
Right. And establishing boundaries is especially important if you are someone who works from home. I work from home and so does my husband, actually. And I think you have to be even more mindful about setting boundaries because especially since the pandemic, a lot of people can now work from home or there's that transition to, being able to work from home a little bit more often, which is a fantastic perk. But when you're working from home, you have to really, really make sure that like this area is my work area. This area is my like living room, my kind of like family time area. It's not blending together, or I have set hours where I'm not going to be checking emails or taking calls because I'm having, dinner with my family. I think it's especially important for those of us who work from home and have home offices to really establish like what those boundaries are, those time and physical boundaries.
Yes, the physical one, especially. Of course, not everyone has the space available to have a physical, a different room that serves as an office. But as much as you can, however you're able to, in your home setting, making it at least a little nook somewhere, at least a little corner where it's not just in the middle of your bedroom or right in the middle of the living room. Just having it at least somewhere where it's a bit separated.
Yeah. I think what we don't want is, the minute you wake up and then, let's say your office is in your room and it's just like there's just like no space or no physical divide between the office and and your area of rest. I've worked with clients where that was like something that caused a lot of burnout and a lot of stress and just even, I don't know, kind of like rearranging things a little bit. But that is like a big one for, I think, a lot of people who end up working from home and thinking about space as an issue. Yeah.
And so another way that you can look at your options at work to help with work burnout is to talk to your boss about your concerns. So maybe you can work together to make changes or solve problems. And so if you set realistic goals for what must get done, I think your boss can be very helpful in that situation. Hopefully you have a supportive boss who can help you in that. So find out what can wait. I think what can happen sometimes as employees is that we're given a certain number of tasks and everything is higher priority. We feel like everything is so important because our boss gave us these tasks. But if you have a conversation with your boss about how you're feeling, then they might let you know, actually, by the way, that task, those 2 or 3 tasks that I gave you, those actually aren't so important. It's okay. I just, mentioned them. It's not something you have to put at high priority. And so you can find out what things can wait. And at the end of the day, if you've made several efforts like this with setting boundaries, speaking to your boss, making changes to your schedule as much as you're able to, if you find that things aren't changing and you're still feeling this way, then you might also want to consider looking for a job that's a better fit for you. That might be what the issue is.
So the second tip that we have, develop healthy habits. And this goes along the lines of self-care. So instead of attempting to fight stress with, fast food or alcohol, I know sometimes, and another thing too, you'll hear people say is, oh, it was a busy day at work, so I'm going to pour myself maybe too many glasses of wine or have too many, alcoholic beverages. So instead of doing things like that, which, and like a wine here and there, it's not necessarily a bad thing. That's something people, I think, have to personally gauge for themselves. But, making healthy choices is going to be in the long run a lot better, especially when you feel like, there's tension going on in your work and work-life balance. So a couple of healthy habits that are just in general good habits to have in our daily lives. So one of them is exercise. So exercise is well known as a great stress buster. Yoga specifically is really great for like just being calming. So if you are feeling stressed, I think yoga is just an excellent one to use for, like relaxing your body, relaxing your mind. You have moments in yoga where, you are practicing mindfulness, which is, another tip, but yoga is a great
Component of
one.
yoga.
Oh yeah. Same here.
Mindfulness and just the physical component too.
Yeah. And also like focusing on your breathing, and there's a lot of benefits. Yeah. I think we both love, we both love yoga. So exercise is a great stress buster. Another healthy habit is to really make sure you're making time for hobbies and favorite activities. So work shouldn't consume you and be the only thing about you. You should have, there's other interests to foster. So whether it's reading novels, going to concerts. I know you, Adeline, you like to go to concerts, playing games with your family. And my family loves board games. So we play a lot of board games. So things like that, making sure you allot time in your day for these things that you love doing, these hobbies, these other interests that you have, and just making sure that work isn't like, 100% your personality, I think is the point here. And then a big one, and I'll admit I'm not very good at this, but sleep. Getting enough sleep is so important. Sleep restores your well-being. It helps protect your health. Getting enough good quality sleep is just going to help you overall with managing stress in the long term. If I ever figure this out for myself, maybe we could talk about it. But that is something I'm aware of, and I just haven't quite gotten the hang of that yet. I'll be,
Yeah.
blunt and honest.
Same for me. Same for me. That's a big struggle that I have too. And I think even thinking back to the example I gave a few minutes ago about during my internship and the burnout I was feeling,
You weren't
waking up
getting
at
enough
4 in the morning,
sleep, right? You're getting enough.
I obviously was not getting enough sleep. So that was part of it as well. I don't think that was the main issue, but it most definitely wasn't helping. So.
Yeah. I'll just have to be mindful if I'm texting you, wait, if we have a 3-hour difference between us, I shouldn't text you right now. Because if you respond, I'm like, oh, did I wake you up? Now you're responding to me?
No,
that's
I'm
something I
probably
try
just
to be
up too
mindful
late.
of.
I'm still working on this one.
Yeah. So even though we know it's about also practicing, that's something, I'm working on. I'm trying to work on. I've been trying to work on. So full disclosure. And then the last one is practicing mindfulness. So mindfulness is being aware of what's going on inside you and around you without judging and without reacting. And this is really great with helping to deal with stress. And something I've used when I've incorporated mindfulness into my life to, help me with sleep and to help me with stress management is using an app on my phone to help me kind of track take a moment at this moment to take deep breaths and things like that. So I think that, since might as well use technology, since technology is something that's at our fingertips, but there are apps out there to help you with mindfulness, to help you with the breathing, and to help you take moments out of your day for these exercises. So mindfulness apps, I think, can be helpful.
Yeah, I know Calm is a really popular one. But I actually really love UCLA Mindful. I recommend it all the time. Yeah, it's free. At least, okay, so I haven't checked the app in a while, but I have gone to the website a few times recently, and I know on the website it's free. It's UCLA, so it's prestigious, it's reputable, and they even have, which I love this part. They have mindfulness exercises as short as 5 minutes, as long as I want to say an hour, and they have them in Spanish too, which I would love that.
That's awesome. Yeah, I've used Headspace. That's the one I've used mostly, and Calm as well. But there are so many out there, and yeah, I think it could be helpful.
And the third tip that we have to help you cope with burnout is to seek support. So ask coworkers, friends, or loved ones for support. Talking to others could really help you with coping. Feeling like you belong can really help with
Oh my
protecting
gosh.
against burnout.
Yeah.
Yeah.
Yeah,
Yeah,
if you
'cause
don't have that at work, that's why it's so hard. But yeah, if you do have coworkers that you could talk to, friends, loved ones, so important.
Yeah, especially coworkers, I think, because part of what we mentioned with burnout is that detachment from people, feeling like you're on autopilot. And so I think support in general is great, but especially if you have a good support system or if you could foster that at work, then that can really help with that autopilot feeling. I know I've had really difficult jobs and have been experiencing burnout where other people felt the same, and we helped and supported each other. And at the very least, even though we felt like we had a lot of work that we had to do and it was hard to keep up, at the very least we were okay, let's have lunch together, we could just decompress and relax and just support each other through that.
And what's nice too with coworkers is that they know what you're going through because they're going through it as well. So they really guys can see eye to eye on that.
Mm-hmm. And if you've done all of this, if you followed all these tips and you still feel really burnt out and for one reason or another, leaving your job is not an option, or not, maybe not something you want to do, of course, then employee assistance programs, they're often referred to as EAP. Many employers offer these, and so many people aren't aware of it. And it's psychotherapy, essentially. As far as I know, for the most part, it's free of charge, and it's a service offered by your employer. It is completely confidential. So I really want to emphasize that, because a lot of times people, I can understand feeling uncomfortable about seeing someone at your job, especially if you have complaints about your job. But in the mental health field, we take confidentiality so seriously. And so, yeah, HIPAA very, very seriously. And so it tends to be a limited amount of sessions, usually 6 to 8 sessions, sometimes even 10, but a limited amount of sessions where you can go tends to be free of charge. And you can talk about, they help you not with very intense issues, but they can help you more with things like burnout and stress, and maybe things happening at home. Nothing like any very serious mental illness. For that, they would likely refer you out. But most definitely look into those services, because it's likely that your employer does offer them.
So that's all we have for today's episode on burnout. So again, I'm Michelle Young, licensed clinical social worker.
And I'm Dr. Adeline Leon, licensed clinical psychologist.
If you liked our show on tips to help you cope with burnout and would like to see more content like this from us, make sure to like this video and subscribe to our channel so you can get notifications when we upload our weekly episodes. And we'd love to hear from you. I'm sure everyone can relate to this topic. Have you ever felt burnout? Have you ever tried any of the tips we mentioned above? Do you find them helpful? Are you going to start incorporating some of these things to help with burnout? So let us know. We'd love to hear from you.
Thanks for tuning in to Mental Health Merienda, your snack size guide to mental health wellness. We'll see you next week.
See you next week. Bye.